Let's do some other stories now. The executive director of Necessary Aid Alliance, Mulumba Songsori, is urging parents to engage their wards in sexual-related discussions. This comes after research findings by his firm show that over 29% of male adolescents are replacing condoms with rubbers for sexual activities in the Upper West Regional Capital. Wow.
Having on training exercises for various health personnel to ensure confidentiality and also issues of privacy in these various health facilities. Most of them are complaining that there's no privacy. You go to have conversations on the issues that affect you as a young person, but the structures available does not permit that privacy component. So they fear going to these facilities. Also, these drugstores, people will have to be trained. They'll have to be trained seriously to maintain confidentiality. That no, you don't have to do leaking information. When people come to buy condoms or come to buy pills from you, you don't have to leak the information to anyone. It's confidential. And also, there has to be an intense education on parents and the religious, but to start discussing issues of what? Sexual and reproductive health. You shouldn't relax with things like this. The various Center for National Cultures, will have to engage parents, more frequently on the fact that discussing issues on sexual and reproductive health with your ward, it's something that is a move in the right direction. You shouldn't shy because of cultural barriers and then religious barriers to say no, discussing these issues with our ward, it's wrong. They should amplify, they should have conversations with their various wards so that it can break the gap on knowledge sourced from friends. Friends absolutely know nothing, they're just like their various peers. What do they know as compared to their parents? So we have to break that research gap so that the parents will dominate. The health institutions should dominate the chat on sources of knowledge.
Let's find out more. Joining us via Zoom is the lead researcher and the executive director of Necessary Aid Alliance, Mulumba Songsori, and also the Upper West Health Director, Dr. Damien Puyungri. Thank you very much, gentlemen, for your time here on Joy News Prime. Let me start with you, Mr. Songsori. First of all, what kind of rubber are we talking about? Is it the regular black polythene bag? What kind of rubber? Just give us, the details.
Yeah, thank you so very much for this opportunity. When we talk about rubber, there are several rubbers which people use. It could be black polythene, but most of them they prefer to use the transparent ones. The ones they usually use for selling the cocoa, which is more transparent, and it's somewhat similar like a condom. So preferably, these are what some of them have been using.
How widespread is it? I mean, your research said 29, but in terms of the nominal figures, can you share with us, and in which particular areas of the capital?
So this research was conducted in one municipal, S3xual West, then S3xual East. We also did some Wa West was another area that was sampled for data collection. So you get to understand what is the trajectory we are talking about here. 61.7% of respondents are sexually active. And when someone is sexually active, definitely, if there are barriers, because if you have to check, if I'm to give you an overview of this research, we set out to go investigate 4 key objectives. First of all, to access knowledge, to also investigate the sources of knowledge, to measure the level of satisfaction on issues on sexual and reproductive health, and also critical is to access the barriers in accessing sexual and reproductive health information and services. So when you come down to the barriers, taking the fact that 61.7% of them are sexually active, it means they'll have to adapt adaptive measures to engage in sexual intercourse. So what are some of the barriers? To get a clear understanding of this situation, you get to understand that most of the rural communities, because of the fact that it's rural in nature, like I said earlier on, the person selling at the drugstore is familiar with almost everyone in the community. So you go there to buy, definitely the information will be leaked to your parents. That, this person came to buy condom. This person came to buy. So
in other words, it's a closely knit community. And so if my producer David walks into a pharmacy or wherever to get his condom, he definitely must meet somebody he knows. And that information is likely to also spread that he's been in there to buy condom. Is that the situation?
Yes, but to get a clear understanding, one municipal was what investigated, and you could see that issues a large place like one municipal, people don't do that because there are several drugstores which someone can easily go and buy, and you might not be known because why it's relatively what a larger place.
Yeah.
So a place like Accra, which is cosmopolitan, people will not have absolutely no fear to go buy condoms because you seldom know anyone there because it's a very large area. But if you go to the rural communities, this is when this is persistent.
Was cost ever a problem or an issue that came up in the course of the research? The cost of the condoms?
Please come again.
Was cost ever an issue in your research? Did it come up?
Yeah, cost didn't really come out as an issue. Okay. When you want to engage in an activity, definitely you should have the appropriate financing to what? Buy it. So cost was not so much of an issue. No one talked about cost because it's something you want to do and you should be what? Financially prepared for it.
Very well. So mainly these are cultural barriers and in terms of the structures. I'm very grateful for your time, Mr. Songsori. But let's get a quick word from the Regional Health Director, Damien Punyungri. Thank you very much, sir. This must be of concern to your directorate. Is this something you are aware of or it is new for you?
So good evening and thank you for having me. Well, I'm hearing about this issue of rubber, people using rubber as condom for the first time. I try to find out exactly, just as your presenter was trying to find out. It's been difficult, but the local name for condom itself is rubber. Okay. So if the interview is in the local language, certainly people are going to, you ask, do you use rubber? That's the question they commonly ask. But it's quite, if the people are really using rubber as condom, it's a source of worry. It's a cause of worry to us as health workers because we've done a lot of education, public sensitization. And then at the community level, fine. Where access is a problem, we have adolescent health corners dotted in the chief zones where young people can go for education, sexual education, and also can have access to contraceptives, including condoms. So it's surprising to us, and it's a concern that people will continue to use rubber because scientifically we know that condoms are tested. They are tested to be effective, and then they are approved by our Food and Drugs Authority to be safe for use, to do the work that they're supposed to do.
But you talk about the community centers and the other facilities that are available to make these products accessible to the young people. But the research also highlights the lack of privacy at some of these centers. Is it something that you identify with?
Yes, we do know that even health workers have their own biases when it comes to sexuality. But what we have been doing is organizing health education. We conduct training for our health staff on adolescent-friendly services and adolescent sexual reproductive health, where they are taken through these things, and then value clarification to ensure that their values align with the values of the Ghana Health Service when it comes to adolescent sexual behavior. That is not to say they should just go and be promoting unprotected sex, but shouldn't be judgmental when young people approach them for education and for their services.
Very well. I'm grateful for your time. That's Dr. Damien Punyungri, who is the Regional Health Director for the Upper West Region. You're watching Joy News Prime with me, Ernest Mino. Still to come, we'll tell you about the rising cost of inflation and if there's ever a solution to this.